I am a doctor.
I am a data collector.
I'm a pharmacist.
I am a clinician.
I am a counselor.
I am a nurse.
When the AIDS pandemic hit, we had information, but with COVID-19, we were never ready for the real impact.
We are frontline workers regardless of the pandemic.
We had to become resilient. That was our biggest motivator.
We are health providers.
We are health providers.
We are health providers.
We are health providers.
Hello, everyone. Hello. Yes, welcome to the PATA 2021 Summit. My name is Sibulele Sibaka, and I'm your host all the way in Johannesburg. It's going to be an exciting one. Now, I know that we have people joining us from all over Africa. And so what I'd really like you to do at this point is to go down to the Q&A and tell us your name, your organization, and where you're from so I can give you a shout out. It's going to be an exciting session. So we'd really like to know who we are talking to. You know, these webinars can get quite stiff, and so we really want to know where everybody is. Please, in the Q&A, let us know who you are, which organization you represent, and where you come from. And while I allow everyone to do that at this point, I would love to talk about what it is we are talking about today. This has been a very interesting discussion. And, you know, as panelists, we were talking behind the scenes and we're like, sure, there's so much to talk about. We only have 75 minutes. So please bear with us as we try and really put together all our expertise and knowledge into this very short time. But today we're talking about how do we make sure that our services are inclusive? How do we make sure that they're stigma and discrimination free? How do we make sure that we are constantly, no matter what the circumstance, no matter what the environment, no matter COVID, that our services that we provide to our clients are youth friendly and like I said, are inclusive. And so there are a number of objectives we're going to, or number of things we're going to unpack today. And one of those is that we do know that stigma is still one of the main barriers that really prohibit people from, especially young people living with HIV and people living with HIV, from accessing healthcare services. And the reality is that if we want to change policy, programming, development, implementation, we've got to find ourselves in spaces like these where we are actually talking about this seriously. And not only that, but authentically and honestly. And so, you know, really ask ourselves questions as healthcare providers that, is it us? Are we the problem? Do we perhaps need more training? Yes, we know that we are passionate, we love what we do, but is it that maybe we need a little bit more training? Or is it our clients that perhaps need a little bit more training, you know, and engagement and making sure that everyone is on the same page to make sure that we deliver the right services? Now, I'm not going to be the one talking about all of this today, certainly not. I have got an incredible panel today who are going to help us unpack this. And at any point, if you have a question, please feel free to jot it down in the question and answer session. So just before I introduce my panelists, I do want to say shout out to Uganda, Kampala, Uganda, to Edith, hello, thank you so much. Aisha in Nigeria, hello. I'd like to say hi to Edwin in Uganda as well. Hey there, CNC Productions in Bulawayo, Spoke in Zimbabwe. Thank you so much for joining us. And I'll continue to say hi to everybody in the first couple of minutes of this webinar. I'd like to introduce my panelists. I mean, you are going to love them. The first one I'd like to introduce, and at this point, if I may ask that my panelists just switch their camera on if it's possible and just say hi so that everyone knows that it's you, so to expect you when it's your turn to answer all the questions. And also the introductions that I'm going to do are very brief. If you want to know more about our panelists, please go through to the Learning Hub. I know you know where that is. And make sure that you get a little bit more information on them. This is just a brief intro, just so you know that we've got creme de la creme here. Dr. Inau, please say hi. Can we see you, Dr. Inau?
Yes,
hi.
yes.
Thank
Hello.
you. Dr. Inau is a sexual and reproductive health provider, a youth frontline worker, and a skilled youth engagement consultant. One of the things that he's really passionate about is making sure that youth are engaged at every step of the way, that youth are taking part in their own sustainable development as well as key decision making. Thank you so much for being here, Dr. Inau. The next panelist that we have is Dr. Pasquin. Hello, Dr. Pasquin.
Hello. Hello, Sibu. Hello, everyone.
Hi.
Hello.
Dr. Pasquin, a medical doctor and a public health specialist and a fellow of the African Institute of Public Health. She has vast experience in tropical medicine, but really is passionate about comprehensive HIV and AIDS care for adults, children, youth, and adolescents. She's really an advocate for inclusive sexual reproductive health and rights services for all, especially marginalized and vulnerable communities. Thank you for being here, Dr. Kaswin. Then we've got a vibrant young man, Dele Fayemi. Say hello.
Hello, everybody.
Hi. Dele is a peer educator and a serious advocate for better drug policies and sexual reproductive health and rights. I mean, this guy here, he won the 2020 Healthcare Provider Champion for the IAS. He's super passionate about drug policy reform, and he was the former coordinator for Students for Sensible Drug Policy in Nigeria. Thank you so much for being here. The next person that we have is Dudu Dlamini. Say hello.
Hello, everyone.
Dudu is the founder of Mothers for Future and Sex Workers Empowerment, which is part of Sex Workers Education and Advocacy Task Force, which is SWET. She's a human rights defender and activist who participates in the fight for the decriminalization of sex work. Thank you so much for being here, Dudu. Next up, we've got Ethel Manyerere. Ethel is a young mentor mother with Africade's Vandiri from Zimbabwe. She's an experienced expert as a young mother living with HIV. Thank you so much for being here, Ethel. Say hi.
Hello, how are you?
Good, good. Thank you. Last but certainly not least, we've got Helena Nangombe, who's a program officer at Athena and is an advocate for HIV and HEYW related issues in Namibia. She has played a key role in the Young Women's Leadership Initiative. And Helena was part of What Girls Want, and she was a former focal point for this, which was a global movement which was run for young women by young women. Thank you for being here, Helena. Say hi.
Hi, everyone.
Hey, so now that you've met our panelists, let me go back to the question and answer and check if there's anybody. Yes, we've got Keenan Ngambi from Zambia. Thank you so much for being here. Awesome. So please continue to tell us where you are, where you're from, and what organization you're representing. Perhaps, just to make sure that I am not leaving anybody out, I do have, just 2 seconds. I think I do have somebody, Sei. Sei is from Nigeria. Thank you so much. Thank you for being here. I just want to make sure that I need to say hi to everybody. Please do say hi on the Q&A so I can see you properly. Thank you so much. While I ask my panelists to please switch on their cameras, can we see you, please? My dear panelists, can you please switch on your cameras? Thank you so much to all my panelists. Please make sure your cameras are on. I am going to go right ahead and ask our tech support to show us the poll. Now, let me tell you why we're having the poll, okay? We would love to get to know you and connect with you a little better. Understand what your thoughts are around the topic we're going to be discussing today, because we all know it could get quite sensitive and tricky. And let me tell you, there are no wrong or right answers. We just really want to know where your headspace is at. Let's get those creative juices thinking and those emotions going. Let's understand where you're from. All right, so the first question, and all our unfortunately, dear panelists, you cannot answer and participate, but this is for all our attendees and participants. Please choose one option. I'm going to read out the questions for you. Question 1, what would you recommend for services to be integrated and to reach out or to reach all adolescent and young people and to be person-centered? Would you rather there be inclusive services that are stigma-free, youth-friendly, and integrated, as in one size fits all, or a dedicated service tailored to specific needs of a particular marginalized key or inadequately served population? Which one do you choose? Please make your choice. I'm going to go to the second one. What is the biggest challenge in my country? Providing services to all adolescent and young people and reaching key or inadequately served. So is it adolescent and young people do not disclose if they are from a key or inadequately served population? Is it criminalization laws make providing services challenging, or is it health provider stigma? What is the biggest challenge in your country, do you think? Is it that young people don't want to tell you? Is it the fact that the laws don't allow? Or is it that the healthcare provider is the issue? The third question is, what does bodily autonomy mean? Bodily autonomy is the right to sexual choices and reproduction. Bodily autonomy is the right to exercise agency over your body, free from external interference, social or legal sanctions, violence and discrimination. Bodily autonomy is the right to individualism and to individual choices. It undermines group decision making. Which one do you think best describes what bodily autonomy is? The last question, what is needed to serve all and ensure inclusive services for health providers? More sensitization training, dedicated staff who are more equipped and professionally trained to deliver tailored services, or is it services that are delivered in the community? So they've got to be in the community where the challenge is. Which one do you think is needed to better serve all the people and all our clients? I'd like to think that everyone has had a moment to respond to that. Attendees, I hope you've responded to those questions. We are going to check out these questions at the end of our conversation. Do all of my panelists have their cameras on? Yes, they do. Thank you so much. This is going to be an interesting conversation, and I really hope that you are making notes. You are more than welcome to go to the question and answer. Let me just double check if there's nobody new who's introduced themselves. No, not yet. Let me go over to the chat. Let me make sure that, all right, perfect. Awesome stuff. I think I've covered everybody for now. All right, so let me get right into it without wasting any time. I know you've had enough from me now. It's time to hear from the experts. And I'd really like to start off this first question directed to Ethel and Helena. And Ethel, I'd like to ask you first. The first question is, can you share with us the challenges that HIV clients encounter at the health institution? Ethel, what are some of the challenges that HIV clients encounter? You can unmute yourself.
Yes, I did.
Great. Ethel, go ahead and answer the question.
Okay, I will list them first, then I'll explain. We have stigma, lack of privacy, verbal abuse, lack of access to medication, and humiliation. So stigma at the clinic is still there, especially to those who are living with HIV. And the problem is some of the health non-medical staff are not trained about it, on how to handle a person who is living with HIV, like guards, clerks, and patients.
Just 2 seconds, Ethel. Ethel would love to see your face as you're talking about such important matters.
Okay.
Please switch on your camera.
I did.
Is the camera on now?
Yes.
Yes, thank you. Please go right ahead. You are still discussing stigma. Yes.
So the problem is some of health non-medical staff are not trained about how to handle a person who is living with HIV, like guards, clerks, and patients at the clinic, who they'll also stigmatize those who are HIV positive. And then lack of privacy. If there is no privacy, people will default. We will default, because the clinic is a public place which means everyone will be everywhere. So I think maybe if we have a new system on how to collect our medication, it will be very helpful. And there is also verbal abuse. Many people, they don't know anything about HIV. So that leads to verbal abuse for people living with HIV at our clinics. If we visit the clinics for our resupply, we'll be at the same bench with those who are having different illnesses. So you then hear by a guard or a receptionist shouting, "Those who wants to go to OI, may you please come forward. We want to start with you first." Just imagine how embarrassed is it in front of everyone. It is that the queue is a book stamp queue. We go to our book stamps so that our book can be stamped. So that is where we are meeting with other patients with different illnesses. So there is lack of access to medication. Not all medication is available at the clinic. So especially to those who are on second-line treatment, will not access treatment and told to go to a different clinic, and they will need extra bus fare and queuing again, and they will spend the rest of the day seeking for treatment. So it's not good at all. So, and last but not least, we have humiliation. Embarrassment is a shame. No one wants to be embarrassed in life. Even you don't want to be embarrassed, right? So when you visit the clinic, you become a joke of the day. At the clinics, other patients will start to call names. Some will say words like ARV damaged your brain, and everyone will laugh. And they'll continue saying that it also damaged your body. That's why your clothes no longer suit you. You know, imagine breathing things like that in front of everyone. Is it a crime to be HIV? Did I want it at the first place to be HIV? The answer is no.
Wow, Ethel, sure. Thank you for that incredibly powerful, moving, and authentic, recollection of what it's like to be on the receiving end of the treatment at some of our healthcare institutions. Sure, yeah. Helena, what would you like to say to this?
Thank you, and I must first say thanks to my colleague for sharing that and just reminding the world that we are still actually seated with stigma and it keeps hurting us. Once again, thank you very much. Like it was mentioned, my name is Helena Nangobe and I'm connecting from Namibia. While I must acknowledge that it is really a concern that we sit still in the 21st century and still to have a conversation about human rights violation, and especially in the healthcare facility, to an extent which it really affects women living with HIV, even those that are pregnant, especially adolescents living with HIV that also do not have much information. We must first recognize that it is extremely important to protect human rights, as it is a critical tool to safeguard the dignity of those living with HIV. Stigma can occur in the community setup level, but it is even more worse when it occurs in the health facility where you are supposed to get support to make the choices to get information so that I am informed, or any other person living with HIV is informed. But we are still seated with stigma that is also come as an obstacles that set fears for us to access these services. HIV stigma has, in so many occasions, has made many of us to go to the clinic and refill our drugs, and also to speak openly about our HIV status. It is even worse that even health provider has severally criminalized us for living with HIV, to an extent of blaming people living with HIV for acquiring it. One would think that we went to the market and buy it. Some of us, we have it, we were raped. Some of us were in situation and we acquire HIV, but anyhow, how we acquired it does not matter. At the end of the day, we just need support. We need information so that we are able to make informed decision. I keep making informed decision because if I go to the clinic and say I am pregnant, or sharing all those things, or you share that I have an STI, a nurse will look at you like you have started sleeping around again and you have HIV already. So we are still seated with such cases. Of course, I must acknowledge that where good services has been offered and the milestone that we have done toward the elimination of stigma and discrimination. But that is not to turn a blind eye, because we still have so many women living with HIV, or people living with HIV, that still do not access the non-discriminatory facilities to access their HIV services on the day-to-day. Because we have normalized the stigma. It continues. Just to share a very short something, that sometimes I go to access my HIV treatment, and to go in the doctor's room or the nurse room, and then you find 6 more student nurses. Really, it is okay to have more trained healthcare providers, but not to the cost of making the space free, because I wouldn't want to share my HIV or my experience that I'm going through at the moment with a room full of 8 people. Nobody would be comfortable if this can be minimized. Otherwise, thank you very much. And I hope from this we can also work toward good solution to end stigma and discrimination. Thank you. Back to you, Madam Chair.
Thank you so much for that, Helena. Sure, Helena and Ethel have really laid the foundation and the ground for us to, first of all, understand the challenge that we're dealing with. Though we may recognize that a lot has happened and a lot of good has happened, as Helena, points to, however, there's still so much that we need to do, right? And I think, having had the 2 of you ladies start this conversation for us, just sobers us up on time. Okay, this is why we are still having this conversation in the 21st century, because we still do have a challenge. And I'd like to move right on, and I want to talk to Dr. Pasquin now. And Dr. Pasquin, I want to ask you, what are some of the things that we need to understand about stigma and human rights violation before we start addressing it? Surely before we start addressing anything, we've got to first understand what the connection is and what the challenge is. What is it about stigma and human rights violation that do we need to understand before we start solving the issue?
Thank you very much, Sibu, and good afternoon, everyone. And thank you for having me on this panel and discussing this very important topic. Just like my colleagues, Ethel and Helena, have already said, stigma is still a big problem. To address stigma in a health setting, we need to have a clear and precise definition of what stigma and discrimination is. Stigma is defined as a complex social process of devaluing a person, beginning with making or labeling someone's differences, attributing negative values to those differences, and this leads to social and economic exclusion of individuals or groups based on real or even perceived characteristics. So stigma is a key determinant of health and health inequity. So to illustrate this process in the context of HIV, and AIDS and populations vulnerable to HIV, people who are stigmatized because they are living with HIV or because they engage in sex work or drug use or express different gender norms fall victim to marginalization. They become the subjects of harassment like Helena and Ethel have just described. They become the subject of harassment, abuse, humiliation, discrimination, and violence. Within a health setting, they are also sometimes provided with poor health services. People who are being marginalized, the health workers provide poor quality services to them. And the result of marginalization can include poor social and emotional well-being, engaging in risky situations and behaviors. And in some instances also, this worsens the economic circumstances, including poverty. And all of this will result in very poor health outcomes. Like my colleagues have already said, discrimination go hand in hand with stigma. Discrimination is described as the unfair and unjust treatment of an individual on the basis of a real or perceived characteristics such as HIV status, age, race, ethnicity, gender identity, sexual orientation, maybe housing situation, immigration status, or even criminal record. And because discrimination tends to be preceded by stigma, it is considered a form of enacted stigma. So individuals can experience stigma and discrimination, facility, community, or at national levels. So at the national level, of course, just like my colleagues mentioned, there are laws and policies and practices that perpetuate discrimination in the healthcare setting. And these prohibit or discourage people who really need to get the services from getting the services. And yet health services is a human right. So discrimination actually affects both healthcare providers and also the healthcare service seekers. And discrimination or stigma is a barrier to accessing and utilizing health services. It's also affecting the quality of those health services in a way that negatively impact health outcomes. So to address stigma in these health settings, we really need to understand stigma and discrimination and know that they are not mutually exclusive. They are intimately related. While stigma is the belief or attitude, the action resulting from stigma is actually discrimination. We also need to understand that stigma and discrimination in a health setting may go unrecognized, especially if the health workers automatically make judgments about people without even realizing that these judgments will affect the quality of services. So stigma is a real issue that we need to deal with. Thank you.
Awesome. Sorry, geez. Yeah, no, your points, Dr. Pasquin, on the ball, like really bring it together. And I do want a follow-up question. I want to ask you a follow-up question based on that, but I'm going to jot it down, and I have towards the end, and I'm hoping that you can, enlighten me on something that you said, because it's important to understand these things, and because we could find ourselves doing the right thing in our mind, but finding ourselves on the wrong side of the law. And so we've got to make sure that we are constantly treading right. Dele, what do you have to say about this? I mean, do you also agree? Stigma, human rights together, you can't separate the two?
Definitely. Thank you very much, Sibu, for the time, for the opportunity to actually speak here. Dr. Pasquin has actually said a lot, and I would really like to add more a little bit to that. Human rights is an outright human rights violation issue. Working with people that actually use drugs, I've got to find out that when it comes to stigmatization, is a very serious issue in Africa. So you get to see when people use drugs, or when people are HIV positive and they want to access healthcare service, you get to hear people talk about how the kind of welcoming the guests is usually not a good one. So it drives them away from people. It drives them away from the society. So there's this separation from the society. So people, because of that stigma, they don't have that access. They don't have that access to people. So they tend to draw away from people because of that stigma. That is why you hear things like you hear calling someone a junkie, calling someone a junkie, for instance. Using such words normally is not something that we accept in the drug policy space. You can say, oh, the person is you can say the person is drug dependent. You get, so you don't say someone is a junkie. It has a negative influence on the person. Or maybe the person comes and tell you that the person is an HIV positive person, and you're like, oh, you must have been involved in multiple sex scandals, or so you get that kind of judgmental attitude. It has a very great negative impact on the emotional well-being of a person, and so they have this societal divide from the people, separation from the people. So stigmatization in itself is a great violation of human rights, and it's something that really affects the emotional well-being of the person that is being stigmatized. That is the person that is being a victim here. So talking about adolescents and young people is even worse for them. It's even worse for them. You can imagine it's a 14-year-old person, teenager, that maybe is pregnant and maybe needs sexual and reproductive health service, and he goes to a healthcare center and tells them that, oh, I'm pregnant, I need help. You get, the kind of service they will get will be like, who, 14-year-old, why will you be pregnant? You get, so these are some of the stigma that are very, 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 very rampant in Africa, very rampant in Africa. And there's some of the areas that we really need to work on, because the effects of stigma is really a lot on the well-being of the people that are victims.
Great. Thank you so much, Dilly. And I think I like the separation that you made, especially when it comes to adolescents, young people. They find it even harder, because you can imagine at that age, you are still unsure of who you are. You're probably not confident. And then you're having to deal with all of those stigma and those discrimination challenges. So thank you so much for that. I do want to recognize all the people that are commenting. I'd like to be clear with everyone. Please request, if you're going to ask a question, please make sure you answer it in the question and answer box. That way we can get to it. We're trying to navigate a lot of communication at the same time. So please, if you don't mind, and the questions that have been asked, you've been noted. We'll definitely try and make some time for them at the end. I'd like to give a shout out to Cameroon Baptist Convention Center. We see you. Thank you so much for being here. I'd like to ask my next question to Dudu. Dudu, for young sex workers, what would you like to see done differently so they can access safe and supportive SRHR services? What needs to be done? What are we not doing? What needs to be done?
There is a lot needs to be done for the both sides. It's not only a side of young sex workers, but also from the service provider themselves in terms of training, but also to open the space where they can meet and educate each other so that they can hear what they need to be done. Because without having a conversation with young sex workers, you cannot able to design any programs for them, because you don't know what they want, what are the challenges they face. So the first thing that I'm thinking that is very important, the first, is to open the space, a safe space for the service providers and the sex workers, young sex workers and the old sex workers, in the same room where they discuss what are the challenges, what they need, what support they need. The second thing is an investment. We need lots of resources to make those services to be available for them. The third thing, it's a sensitization. It's very important, the sensitization, because people who've been service providers, they coming with their moral, their beliefs, and then they tend to use that against the people who need the services. The last thing that I want to highlight, even the policies, we need to looking at the policies that specific for where I base in South Africa. Most of the policies, there are lots of policies that are against around women's body. So we need also looking at those policies that affect those women, all women in South Africa, to assess sexual reproductive health, assess services, but also the system, the health system, the way it operates in South Africa, whereby people wake up 4 o'clock and it's not safe. They can experience a gender-based violence on their way when they go to fetch their medication. And the second thing that they experience, the long queues that is happening within the public sector where they want to access services. So there is certain things that need to be done, but also to looking at the coordination, how it coordinates, because the fact that if you go to the clinic and then you don't access services and then you don't know where to complain, and when you complain it's not going forward, that's taking away the power of the patients to say, okay, how they feel and how they express so that they can assess. So there is a certain steps need to be done carefully so that everyone is going to be in the same page, So for young mothers, I've got certain times when I'm sitting with them and I find that there is a lot of gap need to be done, need to be filled in so that we can because we cannot design any program for them without them. So without them, there is nothing to be done. So they were left behind. I think that is the first step need to be done. We need to sit in the one room and starting to have a deeper conversation with the people who have challenges so that we can get understanding what they want, what are the easy things that they want to do. Thank you.
Thank you so much, Dudu. And you said something in the beginning, which I then want to pose as a question actually to our attendees and our participants. What does a safe space look like? I want us to build this safe space together. You spoke about a safe space. So in the question and answer section, chat box, participants, please tell us what in your mind looks like a safe space. Let's start building it. Let's start creating and crafting it. What does it have? Who does it have? And what are they saying? How are they welcomed? I want us to just really unpack that safe space so that we can start learning from one another about what we think a safe space is. But as you are answering that question in the question and answer section, I want to now move over to Dr. Inau. Doc, how do we best address stigma in the healthcare setting? I mean, I know this is a difficult question. This is like the question. How do we even begin to address this question? I don't know.
Thank you very much, Bulele, and hello to everyone. It's a pleasure for me to be on this panel. And permit me say that addressing stigma in the healthcare setting is somehow complicated, challenging, but not impossible. Because, in a healthcare setting, there is need for effective communication. Especially talking about stigma-free language and a good coordination mechanism between the key players. We talk about service providers, CSOs, advocates, community health workers, and young people living with HIV forms. So there's supposed to be harmonized communication and coordination among these key stakeholders. Take, for example, we had a situation in the local health center where a community mobilizer who was supposed to give retroviral medications to an HIV patient gave that to a security officer in the hospital. And so when this patient came to collect her, to get her drugs, the security officer gave her the second line treatment instead of giving the first line treatment. So the security officer does not know whether it is first line or second line or third line. And he was just there to give the medication to the patient. But that was the role of the community health worker or the community mobilizer to make sure that the right medication or the right line of medication is given to the right patient. And you see that there was a problem, there was a breach of communication within that setting. And so it caused a lot of issues. Let me also say that communities need to be placed at the center of the response. Give it to the community members. What are their difficulties? What do they face? How can we adapt it to their system, to their setting? Don't bring your own approach. Develop an approach that is comfortable for that community, because not every community is the same. you know, and we also have to make sure that we remove the barriers that are found in the hospital, especially discrimination and stigmatizing languages, as has been said by the previous speakers. Also, we need to make service delivery more accessible, especially to hard to reach areas, you know, because there are areas which are very difficult to reach in suburbs, you know. How do we reach those people? They are patients, they are HIV positive people there. How do we reach out to them? How do we meet their needs, you know? And also we need to meaningfully engage key vulnerable populations, young people living with HIV. Talk to them. What difficulties do you face? How can we help you? Because they can best tell you the problems they face and what they think is the solution to those problems. So we need to meaningfully engage them within the healthcare setting. I think those are some of the points that we can use in the healthcare setting. Thank you.
Dr. Inau, you've hit the nail on the head. And I think for me, one of the things that really come up from what you talked about is service delivery, which leads me to, you know, my next question. And I want to follow that up with you before I move on to the next person. And that usually service delivery is a thing of perhaps some places are hard to reach, you know, or at least that's the excuse we tell ourselves. While meanwhile, we know, in fact, that they are just hardly reached, and that we're a little bit lazy, and that we're just not doing what we're supposed to be doing? Or is it not? Is it genuinely that we are dealing with some spaces that are really hard to reach? And how do we ensure, and knowing that there are HIV positive people in those communities, what's a realistic way of getting to them? How do we make sure we get service delivered to them?
Thank you very much. I think it's a multi-sectoral approach. We need to use a multi-sectoral approach. All stakeholders need to come in place, from the community mobilizers to the government, to the healthcare providers, because again, I must tell you that for a healthcare provider to work comfortably, that healthcare provider needs to be taken care of in a very good way. And so you see, government has a role to play. Imagine that I am a healthcare provider, I'm a doctor, and within my setting, within my community, I can't even afford a 3-square meal. I'm not well paid. I have a lot of patients, you know, I have a lot of work to do. So how can we break down these barriers, these problems which we face within the community? It's a multi-sectoral approach. All stakeholders need to come in place, you know, bring everybody together. Let everybody come. We discuss, how can we reach this place? Is it transport? Is it internet? Is it electricity? What is the issue? Is it road? What is the issue? So I think it's a multi-sectoral approach, and we need to target it from that perspective.
And what I'm getting from that is everyone needs to play their part. It is not the responsibility of one person or one group or one stakeholder. Everybody needs to come to the party. Thank you for that, Dr. Inau. Now I want to move over to how can centering bodily autonomy and integrity advance health, rights, and support in making sure that stigma-free, youth-friendly services exist? Helena, please help me on this. You know, you're the expert here on youth-friendly services. How do we make sure that bodily autonomy and integrity are there to advance our need and our mission? Helena? Helena?
Yes, sorry.
Can we have your mic, your camera on, please? Thank you so much. Yes. Did you get the question?
No, kindly repeat the question, thank you.
No worries. So how do we make sure, right? Because centering bodily autonomy can be quite difficult. And so how do we make sure that the integrity is there to advance health rights and support in ensuring that stigma is something that we don't find in youth-friendly services?
Thank you very much. Like we have mentioned earlier about the issues that are still going on, but I think I say that in this situation we need just more trainings to the health facilities, to our health providers, to ensure that these spaces are youth friendly and everybody is accessing the services that are available. Like I mentioned earlier, that people need to be given, they need to be empowered with information. Because if I come in the health facility and I'm seeking for family planning and other services that should be offered there, it's not the right or the chance of the health provider to tell me what to do. But what I need from a health provider is information that will help me to do the decision, the right decision on the right time for me. Because as people living with HIV, adolescents and young women, we need to also make children at the right time. But I don't need to come in there and say, but why are you having a child now? You are 16 or you are 18 and you were born with HIV. But because being born with HIV does not stop me from acquiring what any other person needs. So our health provider should be supportive at any time, at any point, and realize that HIV is just something that lives in us, but that does not mean that it should cut us from accessing what we need to acquire, just like any other person. And also when we are designing programs that intend to eliminate stigma and discrimination in the health settings, we need to involve these people. Do not just involve anybody, but a person living with HIV need to be involved from the beginning to the end. So because they are living the reality of this stigma and discrimination. Otherwise, thank you very much, and back to you, Chair.
Sure, nothing for us without us is what Helena is saying. Thank you so much for that. And I'd like to follow up this question to Dr. Pasqueen, and really talk about, and I know you do a lot of work around this, Dr. Pasqueen, and around training of health providers, around stigma-free services. What are some of the things that we still need to ensure that health providers are well trained in this space?
Thank you very much, Sibu, for that wonderful question. So to ensure that health providers are well trained, first of all, like all my colleagues said, that everyone needs to be involved. So for an organization, right from the board to the senior management, they should be involved. They should intentionally plan for training health workers, empowering health workers. They should have it in their work plans. There should be resources put together for the training of health workers. They should invest in putting right policies so that the health workers are trained, SOPs. They should also be able to monitor and evaluate and ensure that services are being provided stigma-free and inclusive. So all staff should be trained in HIV and SRHR, quality HIV and SRHR services, and adolescent programming, adolescent and youth programming. They should be trained in key population programming, services to people with different diversities. They should have gender transformative training so that health workers can provide a gender transformative approach in providing services. So they should have all kinds of trainings that can enable them to provide services that are free. And in the health setting also, even at recruitment, they should include in the interview questions about stigma and discrimination so that when you're getting someone, you know that they will be serving the young people without discrimination. And of course, also training and empowering the young people themselves and also the key populations or marginalized populations. They should be trained to know their rights. They should be trained also to demand for quality services and not just sit. And then of course, using a peer approach will also help, training and making sure that stigma is not there. And then of course, contact intervention is something that really works well. This is bringing the young people or the inadequately reached, served population to work together with the health worker on a particular common goal. So during this process, the stigmatized person is humanized and the stigma kind of falls away. They see that this is a real person with ambitions. This is a person who has love for people. This is a person just like me. So the person becomes a real person, and it becomes clear that what they are trying to stigmatize really does not exist. So of course it must be also targeted. It should be continuous. It should also be creative. And of course, my colleagues have talked of creating safe spaces and youth-friendly corners, which is also very important in that. And then I saw in the chat box, someone asked about, what about self-stigma? We should create peer support groups that can help support this person come out of their stigma. And of course, I think I've mentioned policies that at the institutional level, we should have policies like safeguarding, we should have code of conduct that we monitor and make sure that no one is stigmatizing on a young person or someone who is marginalized. Thank you.
Sure. You know what I liked? It's that it's the one element you slipped in there somewhere in between, where you spoke about make sure we hire the right people to begin with, you know, right at the beginning. So ask these questions in the interview. You know, we know and we respect your craft and your expertise. We know you are able to do what you need to do. But here we serve young people. Here we serve young key populations. So we've got to know that you'll be able to serve those people as well without stigma and discrimination. And I think that's where it starts. Oh, I love that, Chris. I love that. I absolutely love that. Thank you so much, Dr. Pasquini. And I want to move over to Dele and Dr. E now very briefly, James, just like a minute and a half each. I want to know what inspired you, and I want to start with you, Dele. What inspired you to provide stigma-free services, and what do you want to say to other healthcare providers? What should they be doing? Dele?
All right. Thank you very much for that, Sibu. What actually inspired me was in 2018 when I lost a close relative as a result of complications due to abortion. So basically, she got pregnant. She was 16, she got pregnant. And because of the discrimination, the stigma, you are a Christian, why are you not pregnant? You are just 16, why will you be pregnant, and all of that. And all of that religious, societal bias and stigma actually pushed her to look for self-help. And so she actually had to get concussions and somehow just try and see how she can take off the pregnancy. And unfortunately, she didn't actually make it. She actually bled because of the concussions and all of that. If there was non-discriminatory service that was actually provided, she should be alive right now. So basically, I think that was one of the turning points for me because that stigma was, I would say, was actually what led to her death. And that was what had actually led me to actually providing non-discriminatory service for young people in Nigeria.
I'm so sorry for the loss of your relative. And really, when you hear stories like that, you then realize and recognize that it didn't have to happen. It could have been avoided, you know, had the environment and the space been there. So thank you so much for sharing that. Dr. Inau, what would you say to other healthcare providers? You know, what should they be doing?
Yes, thank you very much. You know, stigma in health facilities undermines diagnosis, treatment, and even successful outcomes. So addressing stigma is fundamental in delivering quality healthcare and achieving optimal health. As health workers, we can and must take responsibility for reducing discrimination in our facilities. Talk about discrimination whenever the opportunity arises. Talk about it. Accept without judgment who people are, how they choose to live their lives, and the choices they make. We must take that into consideration. Who people decide to have sex with, the way they are, we must accept them the way they are and treat them the way they are. I think that is the message I will have for healthcare providers.
Meet people where they are. I like that. Yeah, Thank you so much, Dr. Inau. So, I mean, we've spoken about the challenges, but surely there's some good that's going on. You know, it's not all bad. You know, we do get it right sometimes, and you know, and though we recognize there's a lot to be done, I think though a lot is going well. And I want to go to you, Ethel. As well as Dudu, can you tell us what are some of the things your healthcare facility and communities have tackled, how they've tackled stigma to make sure that their services are inclusive and stigma-free? So for you, Ethel and Dudu, minute each, please, just tell us, just give us a little bit of, you know, what has happened? What have you guys done to ensure that, you know, the services you provide are AOA? Ethel? Ethel, do you want to go while Ethel?
Oh, what we've done so far, we do the sensitization. We build partnership with certain clinics and certain programs and certain organization stakeholders. That was helping us a lot during the COVID-19, where sex workers, they couldn't able to access their medication, but such like TB, HIV, such like VEDS, they were able to bring the medication for sex workers, and sex workers who are peer educators make sure those sex workers, they reach their medication. We also open the space from Sweat, where we invite service providers to come and educate sex workers, but also they having engagement and discussion around what is the best model that they can use, how they can able to reach them. Also using our outreaches to make sure that sex workers, they have partnership with the clinics, and that model works for us during the COVID-19. So I'm thinking that we're going to keep on calling for other clinics to come forward and come to our spaces where we have a safe space for sex workers, and they come and they educate sex workers, but also sharing what the package that they have in their own clinics. But also we want sex workers to take their own responsibility, not to add a special attention, but to take their own responsibility, to know that in Victoria Clinic, I can pop in anytime because they are already sensitized. So the sensitization that Sweat provide in the different clinics, not in this province, Western Cape, but all the provincial cities where we're going into sensitization in the clinics. And we also accept the request from other clinics, maybe if they ask, like, we need a sensitization. So far, so good. I think that we still have like a good service providers who support sex workers, but they're also doing the extra mile. Some of the nurses who are driving during the maybe nights when they are not far from where they stay, they see sex workers, but they assist. We really appreciate what also service providers doing it, but also service providers who making calls in helpline and say, please guys, can you go to this particular corner? I've saw a sex worker very young. She's pregnant and I'm worried. And then we're working very nice with them. But it's not also only for service providers, but also the people who are provincial in departments, different departments, where they can call us and let us know, because sometimes we cannot able to reach some after other places where sex workers operate, but through the service providers who pass, and then they're going to see, and then they call us. Let's work together. I'm still saying, announcing to say, if you feel like you need to learn, you want to know about sex workers, you want to know about the issues and the challenges of sex workers, you want to help, you want to throw, please contact Sweat or 860 60 and or go to our website, and then we can contact you back, and then we provide you with a sensitization.
0800 60 60 60. Okay, thank you so much for that, Dudu. Thank you so much. Ethel, over to you very quickly. You know, what would you say about that?
education of youth workers, public clients, support system to make sure that stigma is free.
Wow. So if I may ask you this, Ethel, very quickly, what are some of the, it hasn't been all bad, right, for you, Ethel, when you go into a healthcare institution. What is the one thing that goes really well when you are going to access medication?
I didn't hear it clearly.
What's the one thing that stands out for you? Is it an act of kindness? Is it something that's kind that somebody says to you? Or, I mean, it's not all bad. And so I'd really like to understand from you, what's the one nice thing that has happened while you are in a health institution?
Okay. Like when we go to our facility, just clinics, to collect our medication, there's some that we call kits. Yeah, I'll make kits as well in the YMM. We'll go there and they will say, sit there, they'll take our books sometimes, and they will process our process at the clinics so that we'll go home early, so that we will not be in a queue, so that we cannot be involved with other people, meeting with other people, other patients who are not HIV. Yeah, that's good for me.
Awesome.
And
thank you.
Also, when we go to our clinic, our reviews, we go to the reception and they will ask us if there is anything wrong. If there is anything wrong, we will be referred to a doctor at our hospital so that we can be able to tell our doctor what is wrong with us freely. We don't have to pay it.
Awesome. Thank you.
Sister in charges.
Thank you so much for that, Ethel. Thank you. I am going to have to move on. And I know you've got a lot of positive stories to share and we want to hear them. I just need to move on to the last question because we are running out of time. And this is an important question that we need to address today. And I want to ask each and every one of you this question, except for Dr. Pasquin, whom I'll ask the last question. So don't worry about that. So to Dr. Inau, Dele, Dudu, and Pasquin, I want to ask you this question. Should we get a one-size-fits-all? You know, and this is all stigma-free, right? Should it be a one-size-fit-all approach, or it should be a tailored approach? You know, if we're going to get this right, what, in your opinion, does the service look like? Do we focus on inclusive, stigma-free, integrated services for all, or do we develop something that's specific towards the needs of those who are inadequately served? And I'd like to start with Dr. Inau for this, just very briefly, 1 minute. Dr. Inau, I think we've lost him. Can I go to you, Dele?
All right. I think it will be actually good for everybody to have that access. It should be something that everybody should have access, because you cannot really tell if someone is an HIV person or if a person is a drug user. You get, so it should be something that is all inclusive. It should be for everybody. It would be good to have it for key populations, but it's better to actually have it for everybody. Everybody should be able to access stigma-free services. And one of the things that we also need to do that Dr. Pasquin talked about that I want to also add is that the kind of service we give, the healthcare practitioners actually taught. They need to be taught. their language, their method of communication with these people, they need to be taught how to use some kind of words. There are some kind of words you don't use for someone that is a drug user, for someone that is HIV positive, for someone that is pregnant and all of that. So we should teach. Comprehensive education is very important. And also in our schools, comprehensive sex education and sexual and reproductive health education should be also involved, should be taught in schools. And I believe that if we can be able to inculcate that too in Africa, it will go a long way to actually reduce that. And there should be tailored service, stigma-free teachings for health workers. And we should be something that should be open for all. It should be open for all.
So if I get this right, Dilly, you are saying that the services should be inclusive for everyone, right?
Yes.
However, you're saying that, like Dr. Pasquin has said, that we need extra training for our healthcare and our health providers. And their training should be tailored towards dealing with young people or people living with HIV, right? That's what they should get additional training that is specific to respond in a stigma-free way.
Yeah, yes. Yeah.
Awesome, love that. Thank you so much. Dudu, what do you say about this? Should it be one size fits all or tailored?
No, I don't think that it's possible for one size fits all. Because I think that we come from in a different background, and also our issues are not the same, but also the approach that we use is not the same, because you might use the approach for a young a sex worker to the old sex worker, but it's not the same, you know. But my belief is that should each services provide, regardless of race, regardless of gender, or regardless of color or whatever, but those services that should be serviced to give it to patients should be equal. You understand? But also the fact that the reality is that they should not saying that because you are a sex worker, you are a trans, you are white, or you are white, so I have to treat you differently. So they should treat everyone equal, different approach. You understand what I'm saying? It's not gonna be same, like can be a same to treat everyone equal, but the approach must be different, because you might need like 25 minutes, the other one is 15 minutes, the other one is 5 minutes. So the important that we need a quality services with the respect and dignity, also protection in terms of not being humiliated because of you are so vulnerable to respond towards any violation.
Sure. Hi, Dudu. Thank you. I'd like to ask Helena. Helena, what is your opinion on this? It's a lot.
Everything I think is what my colleagues have said, but anyhow, the bottom line here is training for our health providers, so that they know, like my colleague who spoke earlier, that bring yourself down to the level of people, because these services need to be inclusive, but yet the health providers need to know, now I am talking to the young lesbian, now I'm talking to a person living with HIV, now I'm talking to the young sex worker, now I'm talking to, because it shouldn't be cut cross just, but they need to understand who they are dealing with at that time. And the space need to be safe for everyone and need to be stigma-free. We don't need judgment in this space. Once we make it inclusive, welcoming, safe, I think it is a way to go, because nobody's included until everybody's included. If you only include some people and leave some, we are still having issues. We are still seated with issues to deal with. So if spaces will be inclusive, I think that will be the way to go. Thank you very much.
So specialized education for a specialized response.
Yes, please.
Sure. All right. Dr. Pasquin, I know you're already doing this. You are doing it. You do it every day. So tell us, please, how are you doing this in practice? Are you not? Please give us a little bit of insight.
Yes, all right, I'm on. Yes, we are actually doing this in practice. Like I said, we have invested in training because, like all my colleagues have been saying, training, because one of the things that was said is that health workers may be afraid, they don't know, they are ignorant. So we actually have invested, we make sure that in our work plan annually, we've included training to empower health workers to provide inclusive and quality, high quality integrated HIV and SRHR services to young people and key populations in their diversity. So we have empowered them, we've trained them in quality HIV and SRHR services, adolescent and youth programming, key population programming, services to people with diversity, not just looking at that gender is binary, gender is more than binary. So training on that, and then of course, training on looking in and looking out, training even board members, senior management, so that they look inside and see, what am I looking at and how can I look out differently and embrace diversity? And then of course, training on for them to confront things that deal with prejudices, myths, and and stigmatization, training on that, how to combat gender-based violence. And they're trained on stigma and discrimination, what it looks like, because they may be stigmatizing and not realizing that their words, even the way they are looking, even their body language could be causing stigma. So they will be trained on that. And then they are also trained focused on adolescents and key populations, and also challenges that adolescents and key populations go through. Like when you're talking of an MSM, what are some of those medical conditions that are peculiar to them? And when you're talking of a young person, what are those peculiar to them? If we are talking of a trans, maybe a trans man or a trans woman, what are those medical conditions peculiar to them? So staff are trained on all that. And then of course, we also work with security. We've also been trained on security of the key population or inadequately reached persons. How do you know that they are not secure? And how do you make sure that they're secure? Even in the health setting, you may be attacked, but how can you combat that? And then of course, we do the training every year. We must do at least 2 trainings, but every team building meeting we have, which is Monday to Friday, we emphasize inclusive treatment. We emphasize differentiated service delivery to our clients. Like my colleague said, not one size fits all, but we look at differentiation of services so that the client is the center. And then of course, I've already talked about the fact that at recruitment, we make sure that stigma and discrimination is addressed so that we can get the right person who also has the passion to treat the people, who is not judgmental. And then of course, we also train and empower the young people and key populations themselves so that they know their rights and they can also demand for quality services, and also that they are responsible in the community. Then we also use a peer-led approach. In all our services, we have peers of all the different diversities that we work together with health workers. We work together as a team. So they are mobilizing, they are also providing, we are doing services together with them. Like my colleague said, nothing for us without us. So we involve the young people, we involved the key populations in their diversity. And then of course, we also use community advocacy. We train the young people and also the key populations on advocacy. How can they advocate for their rights? And how can we go to government and make some asks I already mentioned contact intervention, that we are doing that. We have safe spaces, safe use-friendly spaces. We are having community dialogues. We are having advocacy and lobby meetings. And then of course, we are also translating the information, because the young people need to have correct information, even health workers. So we translate and make sure information, education, and communication material is reaching the young people. And then of course, we monitor and evaluate that we are providing stigma-free and excellent services. Thank you.
Sure. There's a lot that you are doing, Dr. Pasquin, so much. I wish I could put you in my bag over the next couple of days, because we are handling some really tricky territories here in South Africa in our program. And really, I think I'm going to be shouting out to you over the next couple of days for your assistance. But I do know that in wrapping up, PATA does have training for health providers on youth-friendly HIV, SRHR integrated services, as well as training advocacy in action. So if you need more information on this, it's all in the Learning Hub. We've been really fortunate. Yvette has put down the link for the resource. It's there. Let's use it. Let's make sure that we are doing the right thing. And really, this term of leaving no one behind must not just be about our clients, but it must also be about healthcare providers. And Dr. Pasquin so beautifully put that it even has to go down to our board members. You know, everybody has to be singing from the same hymn book. Everybody has to be speaking the same language. If we're not, there's definitely going to be some miscommunication and some disintegration in the work that we're doing. I want to go over to our poll just to give us final results and what our outcomes were. As I've got only 3 minutes left, I just want to go over to our poll. Can tech help us? And I want to see, whoa, okay. So question 1, 71% said that inclusive services that are stigma-free, youth-friendly, and integrated as in an all-in-one service. So 71% said yes, and then the 29% said it must be a dedicated service tailored to specific needs. Right, so question 2, our participants said 71% said adolescents and young people do not disclose if they are from a key or inadequately serviced population. Discrimination laws make providing services very challenging. That's what 12% said. 18% said health provider stigma. So 18% lies on us. Let's check that out. So second last one rather. What does bodily autonomy mean? I'm going to go with the highest one. Bodily autonomy is the right to exercise agency over your body, free from external interference, social or legal sanctions, violence, and discrimination. Thank you so much for that. And the last question was, what is needed to better serve all and ensure inclusive services for healthcare providers? And most people said dedicated staff who are more equipped and professionally trained to deliver tailored services. And that's exactly what Dr. Pasquin said. With all the work they're doing, this is really where we need to be. Thank you to everybody who participated in our poll. And, you know, we want to ask this question as we wrap up. You know, from the audience, what has been 2 key takeouts for you? Please, in the question and answer session, help us to really formulate and bring this conversation and discussion together. What has been the 2 key takeouts for you as audience members in the question and answer section? Please tell us your name, organization, country, and what has been the 2 key takeouts for you. And while you are doing that, I want to give a huge shout out and thank you to Dr. Inau, whom I think we've lost because technology is not loyal. And then I want to say thank you to Dr. Pasquin, Dele Payemi, Duduzile Dlamini, Ethel Manyerere, and Helena Nangombe. Thank you so much for your time, expertise, and your honesty and authenticity, because we know that's the only way we're going to go forward if we start having open and honest discussions about these things. Thank you so much to everyone who's joined us from Mozambique, Eswatini, Nigeria, Kenya, Uganda, Malawi, South Africa, Ethiopia, Tanzania, Cameroon, Zambia, and Zimbabwe. Thank you so much for all your contributions. Please do let us know what your key takeouts have been for today. My panelists, you're amazing. Thank you so much. Thank you. You're amazing. Please don't forget to write down your name, organization, as well as your country and what your key takeouts are. Thank you so much, everybody. Thank you. Asante sana.